Hello everyone, welcome to my presentation on Beclomethasone diproprionate. My name is u3256221. Today I'll discuss the drug's pharmacokinetics, its mechanism of action, as well as the legal, clinical, and ethical considerations. Let's begin. Beclomethasone diproprionate is a corticosteroid commonly used in management of asthma and allergic rhinitis. It comes under the drug class of glucocorticoid class, which is primarily used to treat and prevent respiratory disorders. This medication works by reducing the inflammation in the airways, making it easier for the patients to breathe. Let's start with pharmacokinetics. Beclomethasone diproprionate is administered via inhalation, either through a nasal or a oral inhaler. Upon inhalation, it is absorbed primarily in the lungs, whether it is covered into active metabolite beclomethasone 17 monopropionate. This active form has localized action in lungs, which minimizes systemic exposure and reduces potential side effects after its action in lungs. The drug is metabolized into the liver and is mainly excreted through urine. This first pass metabolism ensures that the drug effects remain concentrated in the respiratory system. Moving on to the mechanism of action, beclomethasone diproprionate functions as a corticosteroid, meaning it works by reducing inflammation at the cellular level. It inhibits the release of inflammatory mediators like cytokines and suppresses the activation of immune cells such as macrophages and eosinophils. This leads to a significant reduction in airway swelling, mucus production, and hyperresponsiveness, allowing for a better airflow and improved lung function. This is why it is particularly effective in treating asthma, where airway inflammation is a primary concern. Let's now look at the physiological effects using a humanoid model. Before administering the drug, the airway is artificially inflamed and narrowed due to the excessive mucus and swelling. This makes breathing difficult and is the hallmark of asthma exacerbations. After inhaling the beclomethasone diproprionate, inflammation in the airways is significantly reduced, allowing the airways to widen and mucus production to decrease. As a result, breathing becomes much easier and lung function improves. However, like all medication, there are potential adverse side effects. The most common of these are oral thrush, especially if patient does not rinse their mouth after using the inhaler, and hoarseness, headache, nausea, dizziness, skin irritation are some of the other adverse effects of this medication. This is a key point to emphasize in patient education. Now, let's talk about the legal consideration. Beclomethasone diproprionate is classified as Schedule 4 medication under the Standard for the Uniform Scheduling of Medicines and Poisons, or SUMP. This means it is a prescription-only drug. Prescribers need to follow legal guidelines carefully, ensuring that the drug is only prescribed when necessary and that patients are monitored for potential side effects, particularly with the long-term use. Misuse or incorrect dosing could lead to serious complications such as adrenal suppressions, and the persons who can prescribe this, the prescribers, are the licensed healthcare professionals like doctors, nurse practitioners, etc. Clinically, it is essential to monitor patients for adverse effects, particularly during prolonged use of corticosteroids. Adrenal suppression is a risk if medication is overused, but step-down therapy may be recommended once asthma is well controlled to limit corticosteroid exposure to some of the patients. Ethically, informed consent is vital when prescribing any medication. Any decision that should be made, we have to engage patients, and patient education emphasizes the necessity of mediation. And lastly, ongoing education will help to ensure patients understand the importance of medication and consequences of improper use. Now, I'll present a few multiple choice questions. Thank you so much for listening to my presentation.